Hello everybody, I'm Dr. Zinal Unadkat. I'm a pediatrician and a lactation consultant practicing in Mumbai. And here you are watching me on Sify.com.
Emphasis on the parenting program.
Today's parenthood has changed. Okay, lot of things parents are lost about. The to be mothers, to be fathers do not have time in the hectic lifestyle. So I feel that going through a parenting session in which you are given the right information and the information which is going to be helpful to you to take you through this journey is very important. So my take is that every couple should go through a parenting session so that they know where they are heading towards. You know the right, you know the wrong, you know what is expected and what is not expected.
The right pattern to breastfeeding.
Breastfeeding is the best thing which one mother can give to their baby. Ideally, breastfeeding should be started within 1 hour of birth, whether it is in the labor room, whether it is at home, or in any hospital setup. The babies are very alert and active when they are born. So within 1 hour, if they are picked up and they are put to breast, they learn how to breastfeed. We are mammals. We don't have to be taught breastfeeding, right? So our babies know how to feed. It's just that we have to pick them and we have to put them to breast. So the right pattern is to initiate feeding within 1 hour of birth and continue feeding as and when your baby wants, which is called as demand feeding, right? So we need to give the baby as much feeding as the baby wants without looking at the watch and without interfering any feed pattern.
Expert guidance on relactation.
Relactation is something in which a mother who has already breastfed, due to some reason her milk has reduced and she wants the milk to come back. Now it is very much possible for a human body to start producing milk, okay, at any point of time. So there are a lot of medications available and there are other remedies available in terms of herbs and breast stimulation which helps in the milk production to start again. According to me, the most important is the breast stimulation, in which the breasts are stimulated, that is either manual stimulation or pump stimulation, okay, or by fondling also, which kind of makes the mother's breast produce more milk. The milk production is actually dependent on the hormones in the body. So if the mother is stressed for any reason, that is the time when her milk output goes down. That is why the mother has to be very happy, and if her mental frame of mind is absolutely calm and positive, she is going to produce a lot of milk. So there is a possibility of you starting producing milk again, which is going to be adequate for your baby, even though your milk output has gone down at any point of time during your breastfeeding journey.
An update on the prescribed newborn examinations.
Every newborn is different, right? Now newborns cannot talk. They don't open their mouth and say, okay, my stomach is hurting or my ear is hurting. So that's why it's very essential to do a newborn examination. Now most of the hospitals in India, at the time of delivery, there's a pediatrician present which examines the baby. So there is one which is the clinical examination, in which the pediatrician assesses the baby's development, the baby's overall external features. But there are so many things which are within the baby which cannot be visualized from the outside, which are not picked up from the outside. For that, if the pediatrician feels or gets some doubt, then there are certain tests which are advised, which can be either blood test, or it can be a sonography assessment, or it could be a urine analysis, in which a newborn assessment is done to evaluate if the baby has any hidden diseases. Also, we have seen in our clinical practice that a lot of babies, if we don't do the hearing evaluation, at a later date we come to know that the baby cannot hear. So I, as a pediatrician, personally feel that the hearing evaluation is a must, which should be done in all the babies to just make sure that the baby is going to be hearing normal.
The set guidelines for vaccinations in newborn babies.
We all want the best for our babies, right? We want the babies to be the best. I'm very sure all mothers are really waiting for that my baby should be the best. So a lot of diseases are rampant in our country, in India. Some are preventable, some are non-preventable, some are life-threatening, some are non-life-threatening, right? So if we see some kind of organism, do we drink that particular water if the water is dirty? No, right? Why? Because we want to take care of our health. Same way, to take care of the newborn baby's health, there are a lot of vaccinations which are available which protect your baby. Now vaccinations are nothing but to make your baby's immunity more stronger. So your babies are going to get more strong, so when they are exposed to those particular organisms at any point in their life, that time they will definitely be reacting in a much more better way and not catch on to the diseases. So prevention is always better than cure. So vaccination should be given to each and every child. All the municipal setups and all the government hospitals also do vaccinations. If at all you want to do all the other vaccinations also, you should go to the pediatrician and discuss it. Now vaccinations, there are lots and lots which have been introduced new in our country. Now we are coming to terms and we are wanting to get into a developed country, so every child should be vaccinated against all the possible diseases which are available.
Your valuable advice on working towards the well-being of a newborn.
I feel the most important well-being of the newborn is the mental well-being, right? We as pediatricians take care only of the physical well-being. Okay, we will guide you in terms of if the baby has fever, we'll give you the fever medicines, we'll guide you on the vaccinations, on the diseases. But the mental well-being is what you as parents can give to your baby. So it's like the overall growth of your baby, where the baby is completely secure, emotionally being taken care of, spiritually being taken care of, and raising in an environment which is very healthier for your baby. So I feel it's the overall nurturing, like the way a plant has to grow from a seed. Till you don't give sunlight, till you don't give water, okay, until you don't give air, the plant is not going to grow. Same way your baby needs overall nurturing. So as a family, as parents, okay, as a community, okay, we are there for you, so give you the best nurturing for your baby.
Induced lactation.
Induced lactation is you are inducing breast milk. So a mother who is actually not pregnant can produce breast milk. It is very surprising to hear this, isn't it? But this is possible. With lot of high-end corporate women who are having late babies or who are not conceiving are opting for an adoption where they are adopting in babies, or they are opting out for surrogacy. So that mother, that woman who's actually going to adopt a baby or deliver through a surrogate, it is possible that she can breastfeed her baby when her baby arrives. Isn't that a wonderful gift what you can give that mother? Because she's going to be bonded to her baby and she's going to be well connected and she's going to get a feeling of a mother. So there is a process to do it in which we kind of stimulate the breast, we give some medications and we give herbs. So we are inducing that mother to actually behave like a pregnant mother, and then when the baby delivers, her body is already producing milk. So I think every mother who's going through this kind of a process should at least be bonded to that baby in terms of breastfeeding. So that's very much possible.